And good day. This is Dr. Latasha McElwain doing an overview of attention deficit hyperactive disorder, better known as ADHD. I'm going to just give you an overview of some of the things to deal with attention deficit disorder, mainly in children for the most part. However, it also can occur in adults. So, wanted to just go over this is for supervision. This is to make sure that individuals have a great overview of what ADHD is and can understand some of the different aspects and what goes on with individuals that might be suffering with ADHD. So, brief overview here. ADHD is prevalent as a neurodevelopmental disease in children. It is also one that persists into maturity and is typically first diagnosed when individuals are very young. Most of the time when we're talking about ADHD with children, many children struggle with their focus. That's one of the main factors there, managing their impulsive behaviors. Other times they are extremely active. They're moving around and they're doing a lot. When we start thinking about the symptoms of ADHD, it is normal for most children to have trouble focusing. They also have some behavior concerns and issues. At one time or another, they may deal with behavior concerns. For the most part, children with ADHD do not grow out of these behaviors, and most times they have severe, sometimes more intense behaviors, difficulties with school, difficulties in the home, and difficulties with making friends and continuing friendships. A lot of times when we are talking about individuals, children with ADHD, a lot of times they do a lot of daydreaming, they forget and lose things a lot, they squirm, they fidget, they talk a whole lot, sometimes talking too much. They make careless mistakes, and sometimes they take unnecessary risks, like going after and doing something that, might not even be a reason why they're doing it. Again, those impulsive behaviors. They have a hard time resisting temptation. So if something looks good, tastes good, might be good, they have a hard time saying no to it. When we're talking about they have trouble with sharing, they have difficulty having good relationships with others. So a lot of times when you think about a child with ADHD, and I would say to anyone, when I think about some of these symptoms, I can remember having some of these symptoms when I was a kid. I can grab my old report cards and remember teachers saying, "Oh, Latasha talks too much in class. Oh, well, she's always fidgeting. She's forgetful. She does a lot of daydreaming." That was my number one symptom in school, was daydreaming. Back then, of course, many of us weren't diagnosed with ADHD, or many of the diagnoses that we have become aware of. But a lot of times, these are a lot of things that children do experience. Our young ones experience it. Whether they end up being diagnosed or not, a lot of times we will try to, as professionals, we will try to see if ADHD fits the mold. But if not, then, then we won't diagnose. Some individuals grow out of some of these behaviors. So being mindful of watching ADHD over a number of years is not something, again, that if it is a ADHD diagnosis, the child would not grow out of it. But at some ages, when we're thinking about some of these behaviors, it is something that could be a case-by-case scenario where a child could possibly grow out of it. So I always tell everyone, when we're considering ADHD, we're not thinking about a person being kind of at a point where, oh, it's going to go on with them for the rest of their lives. Something may happen in life and they may have something that they start to self-regulate, or they start to realize, oh, this, that, and the other, but they may have symptoms of ADHD that are not as apparent anymore as they get older. Our medications may help them to simmer down with some of those symptoms. So just wanted to put that out there because, like I said, every case is different. Our next one is actually talking about the three types of ADHD. We talk about the predominantly inattentive presentation, which is more like our ADD, our predominantly hyperactive impulsive presentation, which is really like our ADHD. And then we talk about the impulsive presentation. So a lot of times when we think about ADHD, we do think in terms of all of these areas. And I've seen all of these areas, especially working with children, where one could be very inattentive, the other one could be very hyperactive, impulsive, and doing things. The other one could just possibly have the impulsive part of it, but not necessarily the hyperactiveness of it. So I've seen it in differences with many children. Individuals with the predominantly inattentive presentation tend to find things, find it challenging to pay attention for a long period of time. They don't pay attention to details, plan, and sometimes, the task completion might also cause some concerns, and then following directions or conversations. Individuals with an impulsive presentation includes pretty much acting without thinking and struggling with self-control. So the self-regulation has not set in yet. Those individuals are definitely impulsive. It could also interrupt others. It could make for critical choices without thinking, just making some decisions without thinking about the long-term effects to it, just being really impulsive for the most part. Next part is individuals with a predominantly hyperactive, impulsive presentation also talks a lot. They fidget. Long periods of stillness is very challenging for them, like sitting down for a meal, sitting down listening to story, doing story time, doing homework. A lot of times what I do is I try to help individuals with ADHD talk about doing things in chunks, where they can get up and move around and come back, and when it's feasible to do just that. Children that are younger may continually, of course, run, jump, and climb, and move around a whole lot. So sometimes I tell parents, okay, 2, 3, 4, and 5, that's kind of normal. But then as we start to notice that it becomes more of a concern as they get older, then we start working into, could it be ADHD? Is that a valid diagnosis for that particular child? Persons that are restless and struggles with impulse control. Impulsive persons, basically, they may speak suddenly. They may pretty much interrupt other people. They may also, it says seize objects from others. But a lot of times they're very impulsive. They don't think before they react or before they do something. So the person that finds it challenging to follow instructions and wait their turn, just you gotta go. And then the impulsiveness increases the likelihood of accidents or injury to some people. So a lot of times just doing things without thinking it through, or doing things just spur of the moment and not being aware or conscientious of what could be the outcome. We start thinking about some of the causes of ADHD. So there is no particular cause of ADHD. A lot of times there are contributing causes that may be linked to genetic factors, yes. But other than that, other causes of ADHD might be some things like, brain injury, environmental risk during pregnancy or at a young age. Also, alcohol or tobacco use during pregnancy, premature deliveries, low birth weight. Also, we look at risk factors. When we start talking about risk factors, males are more likely to have ADHD than females. That's something that we're seeing a good chunk of, in the past few years or past several years. But we do have females that come into play also that do have ADHD. They're more likely to experience the symptoms of the predominantly inattentive. So women or female children are more likely to deal with more of the inattentiveness when it comes down to ADHD, which probably puts them along the line of thinking, in the range of ADD, attention deficit disorder. So a lot of times when we're thinking about other risk factors, we're thinking about the learning difficulties that come along with ADHD, also the anxiety disorder that comes along with it. Anxiety is one of the big ones that we tend to focus on when we're working with children and thinking about the diagnosing of children. Anxiety kind of plays out in different ways with a lot of our children. So we do try to focus on that to make sure we're, being able to look at the diagnoses and make sure that we're doing just that by not over labeling a child or over diagnosing a child, but making sure that when we do diagnose, we are able to make those significant diagnoses to actually be able to assist and move forward in the treatment planning. Other risk factors, conduct disorder, yes. Since a child or individual is not able to follow through with instructions or follow the directions for the most part, sometimes we do come into concerns with conduct disorder for the most part. Individuals that talk a lot may have a lot to say, but sometimes may not be most appropriate to say those things. So we deal with the conduct disorder. Depression comes into play, especially when our younger ones start to realize that they are quote unquote a little different or not like everyone else when it comes down to certain things that they're trying to do and trying to achieve and accomplish. Substance use are among the other conditions that are frequently presented in people with ADHD, because that is something where some people feels like it helped them in so many different ways, which may not be the best way, but it helps them to help manage it. And so substance misuse comes into play. Other things we have to think about is the complications. When thinking about children and teenagers with ADHD, they may have trouble following directions at home and at school, but they also may struggle with sitting for long periods of time, having enough time to eat, or enough time to do their schoolwork. Sitting still for a long time is a struggle. A lot of times look at ADHD may lead to problems such as impulse control, completing tasks, following directions, and having conversation. So when we think about some of those complications, you think about it, they may not get enough to eat. They may not complete enough of their schoolwork, which could have the grades start to plummet. So a lot of differences to think about when we're thinking about ADHD. Also, again, the conduct disorder, depression, anxiety, learning disability, a lot of those things come into play because, again, we're looking at different areas that individuals are trying to accomplish and make as their goal. And then, dealing with some of those things and realizing that there's a little bit more quote unquote complications in being able to follow through with directions, being able to, understand what's going on and stay on track with the rest of the class and everything that's happening in or around them. So a lot of times there is a level of, again, depression, anxiety, and learning disability that goes along with ADHD. So prevention, when we think about prevention, there's no guarantee way to prevent ADHD. However, there are treatments that can help restore the child's focus, attention, and impulsiveness. So also there is treatment in terms of therapeutic treatment, and then also treatments in terms of medication management treatment. A lot of times when we're talking about the diagnosing of what's going on with the child, the doctor will assess a child child and assess adults for adult symptoms, child symptoms and adult symptoms, which symptoms are pretty much the same. But over a period of time, say the last 6 months or so, they would try to assess what's going on to be able to assist that child and to assist that adult as needed. So most of the time, the information is gathered from teachers, family members. It could be, if individuals want to concern some coworkers or whatever, your coworkers might be willing to fill out some documents or whatever, but that's information that kind of help individuals kind of pinpoint what's happening and what's going on. With children, of course, the parents, we do ask some questions of them as well. But once we're gathering that information and then we start to do the assessment, we're basically reviewing and going over the symptoms that meet on the checklist. We're doing some rating scales and things of that nature in order to determine if the person meets the criteria for ADHD. And then going into some of the treatments of it, we start looking at medication management. Medication management is when they come up with the medications that's going to help a individual to concentrate better, to be able to work, to be able to learn and reduce the hyperactive or the impulsiveness that comes along with it. So basically, the dosage of medication, they'll look for the proper dose of medication, of course, based on the patient's based on all the patient's symptoms. But one of the things to think about when we do talk about medication, now they have a lot of extended release type medications that do help individuals, stay on task throughout a full day of work or a full day of class. For the most part, ADHD medication, when I remember working with a lot of kids with ADHD. Some of my parents would take the kids off of the medications on the weekends and then start it back up on Monday morning. I think with some of the medications, that could be an option for some people, but I also think with some of the medications, doing it consistently and ongoing might help, definitely with the part of not making the child feel frustrated that on Saturdays and Sundays they can't kind of get on task and continue to go forward, but on the weekdays they're able to do this because they're taking their medication. So a lot of parents say, oh, I don't want them to become addicted to it, I want them to be reliant on it. But for the best results, then I always tell parents, work with your doctor and see what would be the best policy for you to go by in order to make sure that your child is taking the medication consistently enough that you and your child and the teachers and everyone else is going to see some good results. So stimulation, basically, as a stimulant, the medications will increase the different dopamine and the I can't really say that word, I can't hardly say it, but that's one of those words that get me all the time. But just being real about it, basically the key brain chemicals, these two basically are important for thinking and attention. Those have to work together in order to ensure that an individual is able to be able to think clearly and work and maintain the attention when they're doing things. So a lot of times I tell people it's the stimulants in your brain that you're actually getting the assistance from the medication to help you be able to move forward and do what you need to do as far as staying focused and staying on task. Sometimes there's some non-stimulants. And when we're talking about non-stimulants, we're talking about drugs that take longer to start functioning than the stimulants does. And so a lot of times when we're talking about using different types of drugs, we do have parents talk about it with their doctors to make sure they're able to use the medication that's going to help the child focus, the attention and the impulsivities, or, to make sure that everything is going to be moving along quite normally or quite as it needs to be in order to make sure that they're able to deal with what's going on. And because the stimulants are the ones that really help with the attention, the focus, and the impulsivity, the non-stimulants are the one that really helps focus when we're talking about the boosting the effectiveness and making sure that we're able to, work with the work with the effectiveness of the medication. So a lot of times doctors are the ones that'll go into all of this information when it comes down to treatment with medications and things of that nature. As therapists, we don't really go into that. And that's one of the reasons why that area kind of speaking of the different type of the different parts of the chemicals in the brain that they're going to stimulate, that's something that's on the back end with the medication management. So a psychiatrist professional would be the one that will be talking more about this and giving you more of the ins and outs and everything of it. So moving right along, when it comes down to treatment for us as therapists, psychotherapy is what we do. Psychosocial interventions. We do different type of behavior um, therapy, behavior modifications. We work with families in order to work on how the school can be working with the individual, as well as how mom and dad can be working at home with the individuals. Definitely dealing with emotional issues and concerns, trying to regulate for the most part to situations. A lot of times just staying on task and making sure you're getting things done is the big, concern. We're talking about the behavior therapy working with individuals. So improving the person's behavior is definitely something we go into behavior therapy. We also look at cognitive behavior therapy, and that's pretty much teaching patient how to become more conscientious of what's going on and being able to accept, what's their thoughts and their feelings, and being able to move forward in a way that they can feel successful. A lot of times when we talk about different lifestyles, adapting to the lifestyle changes, sometimes when they do have medications and different things like that that come along, then, they look at things a little differently, and they realize that they can actually help control some of their actions, and they can restrain themselves from temptation and things of that nature, and not taking the unnecessary risk. When CBT is one of those things that we do focus on all of those skills and all of those techniques, but medication changes, also CBT along with medication. That's one of the things that I know I have worked with many families in regards to making sure that they have a good treatment plan for ADHD. Another one to think about is family and marital therapy. Yes, when we're dealing with adults, definitely we want to consider stimulating behavior adjustments to family members and spouses, help managing the disruptive behaviors and enhancing relationships with the ADHD patient. Talking about parenting skills, training. Sometimes we have to think about putting our parents through behavior modifications and behavior parent management treatment. Those are different things to help the parents be able to be motivated and praise their children when it comes down to good behavior, as well as being able to work with parents with how to instruct to utilize a system of like the incentives that come along with it and the penalties that come along with what's going on with child's conduct and behaviors. So a lot of times helping your parents to understand what they can do, how to definitely provide prompts when it's time to praise and for the desired behavior that's being displayed, and then also to help them understand when to ignore or reinforce desired behavior. So a lot of those parenting skills come into play, which some of my parents are very, very accepting of, thinking about making the changes with them. And then a lot of them are very understanding that yes, we can make some changes, but we still need our child to understand that right is right and wrong is wrong when it comes to dealing with their diagnosis. So another thing to think about is classroom management with some of our teachers and some of our professionals. We have to look at making sure that we are dealing with the academic accommodations for the children. So planning for the behavior control and the programs for imparting studies and organizational skills are examples of interventions. These interventions pretty much come along with making sure that the seating in the classroom might be preferential seating in the classroom, which would pretty much be where a child is sitting up front or closer to the teacher or things like that. We're talking about having a lighter workload. Maybe the teacher can work different scenarios out to try to lighten the workload a little bit, or extended time when it's come down to testing and exams. Having examples of these accommodations. And I always tell people those accommodations can be very, very different with examples when it comes down to you having a very creative teacher in place also that actually works with children with special needs and that have need those special accommodations. Also, if a child qualifies for special education services, then the schools may often do the adjustments through a 504 plan or an IEP. And that's a major thing for a lot of families. Just knowing that you can have this type of accommodation in place is a major, because this type of accommodation can help with, even if a child has a hard time writing due to occupational concerns, they can have carbon copy paper where they'll get a copy of their the peer, they'll get a copy of that peer's notes that they were taking during class. So there are a lot of different things that come into play for thinking about the classroom management interventions. And a lot of times teachers get extra, extra courses and extra assignments to be able to work with our children in different ways in the school. They're obligated to make these adjustments and meet these accommodations. Another thing to think about is the lifestyle and home remedies. So some of the lifestyle and home remedies, some people talk about having a nutritious and healthy diet. That is good. Having a nutritious and a balanced, healthy diet is good, because a lot of times when you think about certain foods nowadays, you think about the speed up or the slow down when it comes down to spiking our blood sugars and things of that nature. 60 minutes of physical activity every day, getting plenty of sleep, limitations on screen time, such as the TV, computers, and phones. Being able to learn how to meditate, doing some meditation is always good. Parents and children coping with coping and having support. Parents and children should basically effectively be able to communicate and also be able to work through the treatment plan. So the biggest part of it is educating your kids on what they know they should have. And if they feel like they need it, then they can be an advocate for themselves to reach out to their teacher to actually ask for the accommodation. Develop coping skills and have help regulating emotions and feelings. That's another one. Seeking and building supportive relationships and having coping skills and a good supportive system can lead to better outcomes in dealing with problems and behaviors. And that's always a plus when you have better outcomes dealing with a lot of the behaviors and the concerns. So again, this is all information that is coming from our references that we have here. For the most part, I tell individuals this is a basic overview of ADHD. This is used for the purpose of supervision, and we are happy to share this information in order to make sure that individuals understand some of the parts of ADHD, the overall, considering that a lot of our children are dealing with ADHD, as well as many of our children are getting the assistance with ADHD. And this gives us a good overview of what we can expect and what we kind of see on a regular basis.